The only thing that scares me is when you don't wear me. So please don't leave me. Don't leave me behind. Please don't leave me. Wear a mask every time. Please don't leave me. You're breaking my heart. I know wearing me is tough. Wear a mask. The virus is really rough. Wash your hands. Please don't leave me behind. Stay 6 feet apart. Just wear a mask every time. Please don't leave me behind. No man there. Also hand sanitize. Please don't leave me. Wear a mask every time. Please don't leave me. Let's all do our part.
Good morning and welcome to A Healthier Tomorrow. I'm your host, Will Rucker, and I am so grateful you have tuned in to today's program. You are in for a treat. We have some amazing information to share, and our guest today is going to wow you with the program that she is leading. The A Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. August is National Breastfeeding Month. Breastfeeding has many positive benefits for both mothers and babies. In recognition of Breastfeeding Month, we provided links to local resources and support services on the web at www.gethealthyclarkcounty.org. So to learn more, go to gethealthyclarkcounty.org. As you know, our goal with A Healthier Tomorrow is to inform you about the things that are happening right here in our community that impact and affect our health. Our mission at Community Partners for Better Health is to empower people and our community as a whole with the necessary knowledge and tools to improve health, quality of life, and to eliminate health disparities. This is our mission, and you are a part of that mission. So take a moment right now and text it out, tweet it out, make an Instagram post. Let our community know that A Healthier Tomorrow is on the air and they are invited to tune in. Our guest today is from the Southern Nevada Health District in honor of Breastfeeding Month. Her name is Susie Crutchfield, and I'd like to welcome her to the program now. Good morning, Susie, and thank you for joining A Healthier Tomorrow.
Good morning, Will, and thank you for having me.
Well, I'm really looking forward to our conversation and hearing really a little bit more about you. So for those listening and watching who may not know you, could you share a bit about your background and your work with the Southern Nevada Health District?
Of course, my name is Susie Crutchfield. I'm a nurse here at the Southern Nevada Health District. I'm a community health nurse supervisor. I oversee a couple of the home visiting programs here at the health district. One of the programs we have is Nurse Family Partnership. We've actually had that for roughly 13 years. It's the only nurse family partnership program here in the state of Nevada. It is an evidence-based program nationwide. And what it does, it serves first-time moms. The goal is for us to enroll them prior to their 28-week of pregnancy. And it's specifically for first-time moms. So we partner them with their own personal nurse with the overall goals of improving their pregnancy outcomes, improving the child health and development, as well as improving the family's economic self-sufficiency. Again, that program is evidence-based. They get paired with their own personal nurse, and it's for first-time mothers and must enroll within 28 weeks of pregnancy.
Wow. Okay.
That's one.
Well, yeah, I mean, that's just one thing, and that's amazing. But I want to hear more about how you got into nursing, because admittedly, when I think of nurse, I think of a more medical setting, so a hospital or a doctor's office, but you're sitting there in the health district in your beautiful cubicle. So how did you get into nursing, and how did that lead you to what you're doing now?
So I have been a nurse now for going on 13 years, and it's something that I've always wanted to do. Just for the life of me, I've always wanted to help out babies. That's been my priority, is to just focus on the pediatric patients. So I actually worked here at one of the local hospitals for 10 years and as a pediatric nurse. I was involved a lot with the outreach, meaning I was part and I would sit in with the health district's nurse family partnership. And back then they had another program, Healthy Start. And I just loved what they did in the hospital. I would always see the clients when they were sick or, accidents, injuries, whatever it may be. And I'd always joke with the families that when I discharged them and be like, I hope to see you one day when you're well. So as I learned more about nurse family partnership and the different home visiting programs that the health district offered, I always told myself, it's like, that's where I want to end up. I want to be able to provide education and reach the families prior to them being hopefully preventing hospitalization. So I was a great pro. I was all pro nurse family partnership, and I'd refer all my families that I could and were eligible to the health district. And now I'm here. I'm the program supervisor, which is great, is a dream come true. And it's nice to be able to serve these moms.
That's beautiful. I'm glad that you were able to achieve your goal there. And we're lucky to have you in our community because the care and concern that you have, it resonates and I can feel it way across Zoom. So Las Vegas, are you feeling this love, this care, this concern that's coming through? I certainly hope you're feeling what I'm feeling because I'm inspired. Thank you so much, Nurse Susie. We've got a lot of great information still to come in this broadcast, so let your friends, family, and neighbors know A Healthier Tomorrow is on the air right here on 88.1. Let them know they can tune in. There's still more great information to come that will benefit the health of our community. Before we return to our guest, I want to share this important announcement with you.
Our history, the African American history, is not only filled with struggles and tribulations, but also triumph and pride. We have fought hard to be here today, and we must celebrate who we are and what our future holds. We've come too far to let ourselves become just another smoking statistic. We can't afford to be victims of tobacco. Right now, 45,000 African Americans die from smoking-related illnesses every year, and more African Americans die from lung cancer than any other type of cancer. The time is now for us to live smoke and vape free. Live smoke and vape free for yourself, for our future. The time is now we quit. Why? Because we matter. For free help quitting smoking or vaping, call the Nevada Tobacco Quit line at 1-800-QUIT-NOW. That's 1-800-QUIT-NOW. 1-800-784-8669. Or visit BecauseWeMatterLV.org. Because we matter.
This is A Healthier Tomorrow. I'm your host, Will Rucker. And on the show today is our very special guest, Nurse Susie Crutchfield. Before the break, you were telling us about this incredible program. I definitely want to hear more. And now the program is called Nurse Family Partnership.
That's correct. That's one, like I said, that's one of the programs. It's Nurse Family Partnership. We also have a sister program, which is Embracing Healthy Baby. It's also another home visiting program where you actually get paired and partnered up with a community health nurse, as well as a community health worker. Since Nurse Family Partnership is specifically only for first-time moms, Embracing Healthy Baby, we're able to also provide home visiting services to moms that aren't first-time, that aren't pregnant for the first time, or have a baby under the age of 6 months. Same overall goals is strengthening those families and making sure that baby and mommy are healthy throughout.
That's fantastic. So how much do these programs cost the mothers?
These programs are absolutely free. It's a voluntary program. There is no charge to the families. The only thing, like I said, once they want us out there, we schedule appointments. And like I said, we pair them up with either a community health worker or a community health nurse. And they go to the home, they schedule appointments and just go out and support the moms and provide education and resources.
Are you guys just overwhelmed with just people calling and saying, hey, bring me this program?
We do have a lot of community partners and it's pretty amazing. The ones that know about us and the ones that don't know about us, we want them to know about us because it's completely free. And it's amazing that we have these opportunities to provide all the education and go out to the homes and go out and reach the moms that need the education the most.
Yeah. And I'm imagining for a first-time mom, there's a lot to learn. And I don't have any children of my own yet, but I've babysat, so I have a little experience. But bottle feeding is always like awkward at first, and changing diapers and just knowing why they're crying is always a little uncomfortable. So I could imagine if it was actually my child, how intense that could be. So do you offer any support for like breastfeeding?
Yes, absolutely. Especially in both of our programs, the majority of our staff are certified lactation counselors, and they provide education, especially if the moms enroll during pregnancy. We provide all the benefits and the education of breastfeeding and how important it is for the baby. And the good thing is, since we're home visitors, the team, I should say, is out there doing home visitors. When mommy and baby come home, in the hospital, you have the support of the nurses and everyone else to make sure that the baby's latching properly and everything's there. But sometimes when you come home as a new mom, especially as a first time mom, or even a mom that has her second or third child that's never breastfed, to have that support of the nurse and the community health worker that can go to the home and make sure that the baby's properly latching and that everything's good, that you're doing a great job in general. So yes, we definitely support breastfeeding, as well as we make sure that mommy and baby are doing well while breastfeeding.
So for the gentleman listening who may not necessarily know what latching is, I can share that I was a difficult latcher. I think that may be the right way to say it. I didn't want to take my mom's breast. And so her mom showed her how to do it. Could you
Yes.
explain a little bit what that actually means?
So it's how the baby actually grasps onto the breast to make sure that they're actually getting the milk and getting the milk they need, especially when the babies are very, very young. They're infants and they're just learning. So we want to make sure that the breastfeeding journey is great for the mom. We don't want it to be painful. Usually, the first couple seconds when they first latch on, meaning the baby holds on to the breast, it is just slightly a little painful, but it's supposed to get better.
Well, my mom said it wasn't slightly painful. She said I hurt her. So
It does happen, and that's why it's so important for us to make sure that we go out there and support the moms to make sure they have a proper latch, because in the beginning, usually within the first 30 to 60 seconds, they may experience a little bit of pain for the first couple of weeks, but it should get easier and less painful. So if someone is in excruciating pain during a whole feeding session, it could be that the latch is wrong. And that's where we want to be there to support the moms to make sure you're doing great. And let's see what we can do to make baby latch better.
So that's why this program is so important, why I'm so glad you're on A Healthier Tomorrow today, so that our community knows that this is available. I'm a huge proponent of nutrition, and there's nothing more nutritious for a baby than mother's milk. So this program is something our entire community needs to hear about, and those that need it should take advantage, especially since you said it costs how much?
It's absolutely free to join.
I love that. Thank you so much. I hope you heard that. This program is free. And if you know me at all, you know I love getting stuff for free. So make sure you take advantage of this great opportunity. Before we get to our next question, I do want to share this important announcement with you. So take a listen.
They say it's difficult to quit smoking, but we African Americans are no stranger to hard work and determination. It's easy that we are not used to. Throughout our history and still today, we continue to fight through adversity and injustice, including being targeted by tobacco companies. No longer will we be silent about the negative consequences from smoking. Now is the time we celebrate who we are and what we've become. We will fight against discrimination and judgment, in part by prioritizing health and valuing life. Quitting is hard, but not quitting is harder. The time is now we live smoke and vape free. Why? Because we matter. For free help quitting smoking or vaping, call the Nevada Tobacco Quit line at 1-800-QUIT-NOW. That's 1-800-QUIT-NOW. 1-800-784-8669. Or visit BecauseWeMatterLV.org. Because we matter.
I hope you heard that information. It's so important, especially for our community, that we live vape and tobacco free. And if you do have any questions, know that I'm here personally to help you, and we can quit together. How about that? All right, let's return to our very special guest with more information. So do you also provide other resources besides the assistance with breastfeeding?
Of course. So both programs, what their overall goal is to provide education as well as resources. So our main goal is to make sure that the families are economic self-sufficient because as we all know, that will positively impact even generations to come. So if we have moms enroll and they haven't received their GED or high school diploma or want to go into college or any additional training, the nurses and community health workers will meet them where they are. It's like, okay, what is your goal in life? And create baby steps into giving them the resources that they need to be able to obtain their overall goal. Whatever that may be, whether it's going back to school, getting a job, in general, whatever we meet them where they are and kind of what they want to accomplish in life as well.
Thank you. Now, Susie, what is your favorite part of the program?
Honestly, I think it's just amazing for us to go out there into the homes and provide that one-on-one education. We all know there's lots of programs out there which are amazing where you can do the bigger classrooms and learn a lot about whether it's labor and delivery, baby basics, breastfeeding, everything in general. But with our programs, the nurses and the community health workers are able to build a strong therapeutic relationship with the families where they're comfortable enough to let us in their home into their personal space as well as share their personal experiences and how they're feeling with us. So the fact that our nurses and our community health workers can be there to support and guide the families for at least, with Embracing Healthy Baby, it's up to 1.5 years to 2 years. With Nurse Family Partnership, if you enroll during pregnancy until a child is 2, that's close to 3 years. So for us to be in the home and be involved, to be able to make a difference in every family, you see tons of success stories, and I love hearing it from our home visitors, how the family started off like this, and by the time they complete the program, they've accomplished so much. It's a great feeling to know that we're making a difference in the community out there like that.
Yeah, I've got the warm and fuzzies just listening. That partnership for me is what really stands out. This program is presented by Community Partners for Better Health. So having that relationship where you're there to support families in a very real and intimate way
Mhm.
is something that I just take my hat off to and applaud and appreciate. So
Yeah.
now that we've got the audience all excited about it, I know we've got 100 new moms. They're like, well, how do I get in touch? How does someone get referred to this program?
So it's very easy. Individuals can self-referral themselves by calling myself or Teresa, who's one of the leads. I'll give you the phone number. My phone number is 702-759-0892. Or they can also call Teresa, who's one of my leads for Nurse Family Partnership at 702-759-0779. They can self-referral. We also partner with a lot of community partners that sometimes will fax over a referral. But honestly, if someone just makes the first initial phone call, we'll do the rest.
Awesome. And how does someone become a referral partner? Is that just calling you as well?
Yep. Any agencies, we have multiple community agencies, whether it's OB offices, resource centers, women's. We partner with a lot of agencies here in town. It's good for us to know the different services that they offer. That way we can let our families know of the services that are offered out in the community as resources for them, as well as they can send all their families our way. We're eager to help every first time mom or even mom that has a child under the age of 6 months. We can help them.
Wonderful. And I have to give a shout out to the community health workers. They have a special place in my heart as well. And I'm working diligently to try to increase the amount of community health workers we have, and also the recognition for the important work that they do alongside nurses such as yourself. So, Susie, is there anything else our listening and viewing audience should know about the program or about your work at the health district?
No, I mean, the program, like you said, and we've touched, it's completely voluntary. They're completely free, and we're just there to meet the moms where they are, regardless of what stage in life they are. I mean, from pregnancy until their child turns 1 or 2 years old, we just want to be able to help them and personalize this home visiting experience to cater to what their personal goals are and making sure that mommy and baby are healthy and thriving.
Awesome. Well, give us those contact numbers one more time.
Of course, they can call me directly at 702-759-0892 or Teresa at 702-759-0779.
Well, thank you so much for all of that information, Susie. I am so excited to promote your programming, especially since it is completely free. And I'll mention that one of the things that I'm personally involved with is tobacco cessation in our community. And so helping expectant mothers to quit smoking or vaping or any tobacco use is something that I am a huge advocate for. So I just want to throw in a little plug. If you fit into that category, or if you use tobacco of any sorts, call 1-800-QUIT-NOW and you can receive free help quitting your tobacco use today. I hope that you take advantage of the resources we've shared on the show today. And I want to take just a moment and talk to you, if that's all right. Las Vegas, is it all right if we talk just you and I? You know, our health is something that we have to start taking seriously. This program has been on the air for years, and I am so grateful for the opportunity to serve as the host of A Healthier Tomorrow and to really work with community partners for better health in presenting the programming that we do. When this organization was started, there was a need identified. And guess what? That need still exists. Well, what is that need, you might be asking? That need is information for you and I so that we can take care of each other. We don't need to worry about any disagreements or divisions we may have. Right now, it's the time for us to come together. I'll say it one more time. It's the time for us to come together and really take our health seriously. So many of us have experienced so much during this COVID-19 pandemic. And guess what? It's still not over yet. We've still got a long road ahead, but the road will be easier if we do it together. So my message to you today is simply, let's get together. Let's join in unity and really take care of the things that matter. Let's make the main thing the main thing. And what is the main thing? The main thing is our health, because if we don't have our health, really nothing else matters. We can have all the riches and fancy cars and nice clothes and whatever else may be. We can have all of that. But if we're not healthy, what do we really have at the end of the day? Too many of us have left this planet way too early because of things we could have prevented, because of things that did not have to impact us the way they have. We've lost mothers and fathers, sisters, brothers, aunties, uncles to COVID-19, but we've also lost them to heart disease and to diabetes and other preventable diseases. So Las Vegas, I'm asking you today, from my heart to yours, join with me on this campaign for better health. We can make tomorrow healthier. Our health is truly in our hands. And that's my job. Like, that's why I'm here, is to give you information, to give you tools, to put things in your hands so that you feel empowered, so that you are empowered, and so that you can empower others. So I just want to say thank you for your support of this broadcast, for your support of Community Partners for Better Health, and for your support of yourself because of the steps you are taking to improve your health, making for a healthier tomorrow.
The COVID-19 pandemic is changing our way of life. It is hurting African American and Black people in our community. In the US, 30% of hospitalized patients are Black, but we only make up 13% of the population.
Our elders and those who have diabetes, heart disease, or other health conditions have a higher risk for severe illness or even death. Remember, even people who feel healthy may carry and spread the virus. This isn't about living in fear, but about doing what we can to reduce the risk. Let's stop the spread of COVID-19 in our community.
My family and I follow these simple steps, and we encourage you to do the same. We wear a face covering in public or when we are with people outside of our household. We keep 6 feet apart. We wash our hands frequently. We stay home if we don't feel well. If you think you have been exposed, contact your health provider or dial 211 for more information.
These are challenging times. We all want to get back to normal. A vaccine will help us get there. It's important to step up to protect us against the virus, so take the time to learn more.
We have the power to take care of our community. Let's use the power to protect all of us.
The Healthier Tomorrow radio program is sponsored by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. In August, we recognized the 7th annual Black Breastfeeding Week as an opportunity to raise awareness of the gaping racial disparity in breastfeeding rates and to motivate action. To learn more about the resources and support available for breastfeeding, please visit the website www.gethealthyclarkcounty.org. Again, that is www.gethealthyclarkcounty.org. That website is filled with tons of resources for our community. You will not be disappointed. As I always remind you, you are not just a drop in the ocean. You are the ocean in a drop, and what you do matters. So live compassionately, speak compassionately, and that includes compassion for yourself by taking care of yourself, getting out for a walk, eating healthy meals. If you are using tobacco, establishing a quit plan. All of those things are compassionate acts that you can do for yourself. And we know we need more compassion in this world today. This month, a lot is happening. So make sure you stay grounded, stay hydrated, and stay connected to community partners. You can visit us on the web at cpbhlv.org, where you can find out more about this program, as well as the other programs and outreach efforts that we have. I am your host, Will Rucker. This has been A Healthier Tomorrow, and we will see you next month on the second Wednesday at 9 a.m. Until then, stay well.
The only thing that scares me is when you don't wear me. So please don't leave me.